Good afternoon. My name is Paul DiGiacomo, President of the Detectives Endowment Association. On behalf of the DEA Board of Officers, we are pleased to offer our membership this informational seminar. It is our intention to clarify and explain New York City's new Medicare Advantage Plus plan for our retired members. This new plan will take effect on January 1st, 2022. This plan will not affect your DEA benefits, which include your dental, optical, hearing aid, and prescription drugs. It is truly our honor to represent both active and retired NYPD detectives. You are truly the greatest detectives in the world. I will now turn the seminar over to Kim Parker and Marlon Pavone, account executives from Empire Blue Cross Blue Shield. Thank you so much for your time.
Thank you, Paul. I appreciate this opportunity to present to the DEA. At this time, I'd like my colleague Melissa to please pull up the presentation deck so that we can go through the presentation material for the retired members. Thank you, Melissa. Once again, I'd like to take this time to thank everyone for attending today's informational session, and I want to thank the DEA and leadership of the DEA for giving us this opportunity. Today's presentation is an informational presentation, and I hope to be able to address proactively many of the most commonly asked questions that we've received from retirees over the past 2.5 months. The goal of today's presentation is to educate you so that you are equipped with all of the information to make an informed and educated decision on your benefit choices for 2022. During today's presentation, I'm going to go through a few things. First and foremost, I'll go through some Medicare basics, specifically how Medicare Advantage compares to original Medicare and the GHI Senior Care Plan. I'll spend quite a bit of time talking about national provider access and the providers that members will be able to access under the Medicare Advantage Plus program. I'll review through the enhancements. These are the additional benefits and services that are included in the Medicare Advantage Plus plan that are not included under traditional Medicare today. I'll do a high-level benefit comparison, and then I will open it up to some questions and answers at the end. Melissa, you can move to the next slide. Thanks. Now on this slide, this shows an overview of how original Medicare compares to a Medicare Advantage Plus program, specifically the New York City Medicare Advantage Plus plan. Under original Medicare, traditional Medicare is divided into two parts. You have your Medicare Part A, which is your hospital portion of Medicare, and then you have your Part B, which is your medical portion that covers your doctor's visits. And then you have your supplemental or secondary coverage through the GHI Senior Care Plan. Under the Medicare Advantage Plus program, we're combining all of those pieces together into one program. So it creates a simplified experience for the member because we're combining all of those parts into one plan. So under the Medicare Advantage Plus plan, we will be covering all of your Medicare Part A benefits, all of your Medicare Part B benefits, as well as acting as the supplemental coverage by combining it all together in one program. Now, by combining everything together, you will have one identification card. So currently today, you're carrying around your red, white, and blue Medicare card, your GHI medical card, and your Empire hospital card. You will now have one identification card, and that will be your New York City Medicare Advantage Plus ID card. That also means that you're only going to receive one explanation of benefits for covered services. So you're no longer going to get an explanation of benefits from Medicare, and then an explanation of benefits from GHI, and an explanation of benefits from Empire. You'll receive one combined explanation of benefits from the New York City Medicare Advantage Plus plan. So by combining all the pieces together, we are creating a simplified experience for the member. Now, since the New York City Medicare Advantage Plus plan is a contracted plan with the CMS, the Centers for Medicare and Medicaid Services, we are required to cover all services that are currently covered under traditional Medicare. So if it's a Medicare covered service, it will be covered under the Medicare Advantage Plus program. We follow all of the same Medicare coverage guidelines, as well as the Medicare medical necessity guidelines. So once again, if it's a Medicare covered service, it will be covered under the New York City Medicare Advantage Plus plan. Now, in addition to all of the required Medicare services that we must cover, the plan will also include additional enhancements, programs, and services that are not currently covered through traditional Medicare. And I will go into a lot more detail on the enhancements a few slides later in the deck, but just to call out a few, Silver Sneakers, which is the free gym membership, is included in the program, as well as a non-emergency transportation benefit, healthy meals, a fitness tracker, just to call out a few. So once again, if it's a Medicare covered service today, it will be a Medicare covered service that will be covered under the New York City Medicare Advantage Plus program. Now, this program is a customized program that is not available to anyone off of the street. So this program was truly created specifically for the City of New York and the City of New York retirees. So it is a customized national PPO program that will cover retirees anywhere you live in the United States. So it's a custom plan just created for the City of New York members. Melissa, you can move to the next slide. Probably the first question or most important question that I've been posed to from retirees over the past 2.5 months is regarding the providers that you'll have access to. Now, I mentioned earlier that this is a national PPO program, which means it's going to cover retirees no matter where you live in the United States or US territories. And members will have access to all Medicare participating providers nationally. There's approximately 850,000 providers that participate with Medicare today. But what's important to note is of those 850,000 providers, over 640,000 of those providers are actually in-network contracted providers, either with Emblem Health, Empire Blue Cross Blue Shield, or any one of the various Blue Cross Blue Shield plans that are located throughout the country. So for example, if you live in Florida, members in Florida will access in-network contracted providers through Blue Cross Blue Shield of Florida. If you live in New Jersey, you'll have access to Horizon Blue Cross Blue Shield providers. In North Carolina, it will be providers that participate with Blue Cross Blue Shield of North Carolina. Now, this is a national PPO program that accesses the full Blue Cross Blue Shield National Association of Providers, and that encompasses over 640,000 in-network contracted providers. But what's important to note here is you're not bound by just network providers. You as the member have the freedom to go in or out of network and see any Medicare participating provider across the country. The benefit structure will be the same whether you use an in-network provider or an out-of-network provider. So if it's an out-of-network provider, we will pay that provider directly the full maximum Medicare billing allowable amount. So from a member's perspective, the only responsibility you'll have is your applicable copayment for the service that you have rendered, whether you see an in-network contracted provider or an out-of-network Medicare participating provider. I did want to share an update with the retirees regarding our progress with the in-network contracts for both Memorial Sloan Kettering and Hospital for Special Surgery. I'm happy to announce that Memorial Sloan Kettering is an in-network contracted hospital that will be accepting the New York City Medicare Advantage Plus program. And we are close to finalizing the in-network contract with Hospital for Special Surgery. Melissa, you can move to the next slide, please. Now, even though you're not bound by a network and you have the freedom to see in or out of network providers, many members like to know the peace of mind that their providers are in the network. And important to note that currently today, over 90% of the providers that City of New York members are using are actually in-network contracted providers. So there's a very good chance that the doctors you're using today are actually participating in network providers. Now, there's two easy ways for you to confirm if your provider is in the network. One of the easiest ways is to call the New York City Medicare Advantage call center at 833-325-1190, and the representative will be more than happy to look up your providers on your behalf. Or if you wanted to search the provider finder tool on your own, you can access the Find Care link by going to the dedicated website that was set up specifically for the New York City Medicare Advantage Plus plan. And that is the empireblue.com/NYC-MA-plus. And that will bring you to the dedicated website. And in the middle of the page, you'll find something called Find Care. When you click on Find Care, that will bring you to the provider search tool. And you can look up specific providers by name. You just need to know either the zip code or the city and state where the provider is located. And then you type in the provider's full name, the full first name and full last name. Make sure you do not put doctor before the provider's name. That will negate the search. So you can look up for specific providers anywhere across the country. And you can also have the ability to do a broad search. So if you want to see what hospitals participate in your area in New York, you can type in the zip code that you're looking for, and then just type in hospital, and it will pull up all of the hospitals that fall within a geographic range of that zip code. So you have the ability to do a broad search, or you have the ability to search by specific provider name. But once again, it is a passive national PPO, which means you have the ability to go in network or out of network, and your cost share will be the same, regardless if that provider is participating in the network or is an out of network Medicare participating provider. Melissa, you can move to the next slide, please. I mentioned early on that there's a whole host of additional enhancements that come with the New York City Medicare Advantage Plus plan that traditional Medicare does not cover today. The first one is Silver Sneakers Fitness Program. And this is the free gym membership that's included in the plan. Members will have access to over 16,000 gyms that participate in Silver Sneakers nationally. It's a portable program, which means you have the ability to change your Silver Sneakers gym from one state to another. So if you're a snowbird and you spend the summers in New York and your winters in Florida, you can switch your Silver Sneakers gym location to one in Florida. Silver Sneakers also offers on-demand classes as well as virtual classes for those individuals that are not yet comfortable going back to an in-person gym setting. So they've really pivoted as a result to accommodating during the pandemic. And it seems that many members continue to utilize their virtual platform. We also include non-emergency transportation. And this is basically a car service to and from your doctor's appointments, pharmacy, and hospital visits. And the non-emergency transportation car service will need to be coordinated and set up 48 hours prior to your doctor's appointment. We have a concierge health guide customer service model that's set up to assist members with coordinating many of these programs and benefits. So the concierge health guide is there to assist you with setting up that non-emergency transportation ride. And the concierge health guide is also there to assist you with accessing many of the other programs and services that are included in the program. So this customer service team is there not only to look up claims on your behalf and answer benefit questions, they're really there to help advocate for our members, to ensure that our members are getting the most out of the health plan. And they'll actually get on the phone and coordinate setting up doctor's appointments on your behalf as well. So the Concierge Health Guide is really there to advocate on your behalf. We also include telemedicine or a telehealth benefit through the Live Health Online application. And this will allow you to have a virtual doctor visit with a board-certified physician over your smartphone, your tablet, or your computer. And those telemedicine visits are a zero copayment. So you can have a virtual doctor visit with a board-certified doctor for a zero copayment. We also include a healthy meal benefit, which is primarily designed for post-discharge from the hospital. So members will receive up to 56 meals delivered to your home each year post-discharge from the hospital. Members could also qualify for the healthy meal benefit if they are a diabetic and have an elevated A1C level, or if you have a certain body mass index number. In addition, we also have the healthy pantry benefit, which is designed for members with certain chronic conditions. And I always use a diabetic member or a cardiac patient as a good example. It's proven through a few minor dietary changes, those conditions can help be managed better by changing some dietary changes. So under the healthy pantry benefit, qualified members will receive a shelf-stable pantry box delivered to their home each month, as well as have a supportive telephonic nutritional counseling session with a dietitian each month to ensure that you're staying on track. We also want to incentivize and reward members for doing their wellness and preventive screenings. So through our wellness rewards programs, members will have the ability to earn gift cards every time they do a preventive wellness screening. So for example, in the beginning of the year, when you do your health risk assessment, you have your annual physical, you do your colonoscopy or your mammography, you have the ability to earn gift card rewards for doing those wellness screenings. We also have the Sydney mobile app, which allows members to download their full benefit program directly to their smartphone. So you'll be able to access your benefits, view claims, download your identification card right on your smartphone, and you can show that to your doctor's office when you go in for your appointment. So it really gives you the ability to have your full benefit plan on the go in your hand on your smartphone. The plan also includes access to our 24/7 nurse line. This is available 24 hours a day, 7 days a week, and it's staffed by registered nurses. And it's really set up to help members assess symptoms. Members quite often use the 24/7 nurse line after hours or in the middle of the night when they cannot get in touch with their family physician. And the nurses are there to really help triage and assess your symptoms to ensure that you're getting the appropriate care. So for example, they may assess your symptoms and say you need to get to the emergency room right away that night, or they might say that this is something that could wait until the morning when you have the opportunity to contact your doctor. We also cover worldwide emergency and urgent care while you're traveling. And this is important because traditional Medicare does not cover services outside of the United States. So under the Medicare Advantage Plus plan, you will have coverage worldwide for urgent and emergency care. We also offer members discounts for certain products and services that are offered through our special offers programs for preferred vendors. And they can include discounts on weight loss programs like Jenny Craig, or vitamins, or LASIK surgery. So all of those services are offered, the products and services are offered at a discounted rate to our members through the special offers program. We also have the Medicare Community Resource Support, and this helps connect members to the local community resource support that's located in your own neighborhood. So many of us don't realize the amount of community support that's available to us. And this team is there to really help connect the member to that local community resource support. A good example of this is connecting a member with maybe a local church to help them build a wheelchair ramp to get into their house. So the community resource team is really there to connect you, the member, with your local community resource support that's in your neighborhood. Routine foot care is covered under the program, 12 routine foot care visits per year, and that's for all members. You do not need to be a diabetic to qualify for routine foot care. So this is for all members, 12 routine foot care visits per year. We also have the health and fitness tracker, which is basically a free Fitbit for members, and you'll be eligible to get this Fitbit every 2 years, as well as access the online health and fitness tracker program that links into your Fitbit that can help track your fitness. Melissa, you can move to the next slide, please. Now, this is a high-level benefit comparison between the New York City Medicare Advantage Plus plan and the GHI Senior Care Plan. And I recognize that not all members are covered under the Senior Care Plan, but we like to include a high-level comparison to the Senior Care Plan because that's where the majority of the New York City retirees receive their coverage today. The Office of Labor Relations website does have a benefit comparison document for all of the plans that is offered through the City of New York today. So you can go on to the Office of Labor Relations website to see a side-by-side comparison of your plan compared to the New York City Medicare Advantage Plus plan. So all of the plan comparisons are on the Office of Labor Relations website. I do want to call out a few benefit changes that will be going into effect for the GHI Senior Care Plan effective January 1st, 2022. The first call out is the fact that there will now be co-payments that members will have to pay under the Senior Care Plan for all doctor visits. So there will be a $15 copayment for both primary care as well as specialty visits under the Senior Care Plan. I also wanted to note that the Medicare Part B deductible will be increasing for 2022. So currently today it's $203. That is projected to increase to $217 for 2022. So those are two benefit changes that will be impacting the Senior Care Plan for January 1st, 2022. Now, comparing this program to the New York City Medicare Advantage Plus plan, the Medicare Advantage Plus plan will have a $253 deductible, and that's combined for in or out of network services. So that means the member would be responsible for the first $253 in covered medical services. You also will have a maximum out-of-pocket protection under the Medicare Advantage Plus plan. So the maximum out-of-pocket under the Medicare Advantage Plus plan will be $1,470. So that is the most that you'll pay out of pocket for your deductibles and all of your co-payments that accumulate throughout the course of the year. So this is your safety net. And once you reach that maximum out of pocket, there will be no additional co-payments or out-of-pocket expenses the member would have to pay. So that is your safety net catastrophic cap. Under the GHI Senior Care Plan with traditional Medicare, there is no annual maximum out-of-pocket. It's unlimited. And what that means is your co-payments and out-of-pocket expenses can continue well above that $1,470 cap that the Advantage Plus plan has. So there is no maximum out-of-pocket. It's unlimited, which means your costs will continue and there will be no catastrophic cap. And this is important for those members that may not have that 365-day hospital rider under the Senior Care Plan. Those members could be potentially exposed to tens of thousands of dollars of uncovered Medicare Part A expenses. So the catastrophic cap of $1,470 under the Advantage Plus plan is an important safety net for you. Now, under both programs, there is a $300 copayment per admission for an inpatient hospital admission, with the $750 per person maximum per calendar year. So if a retiree has 3 separate hospital admissions in 1 calendar year period, the most that they would pay would be the $750 maximum. Skilled nursing facility care is covered under both plans. For the full 100-day benefit period is set by Medicare, and it's a 0 copayment for days 1 through 100. Now, the difference between the Medicare Advantage Plus plan and senior care comes down to the primary care physician copayment. Under the Medicare Advantage Plus plan, there is a 0 copayment for your primary care doctor visits. There will be a $15 copayment for all specialty visits under both plans. Your emergency room copayment is $50, but under the Medicare Advantage Plus plan, if you're admitted into the hospital within 72 hours of that emergency room visit, that $50 copayment will be waived. And this prevents the member from being responsible for both a $50 ER copay and then the additional $300 inpatient copayment. Dialysis is covered, a 0 copayment for dialysis on an outpatient basis or dialysis that's done in a home setting. Now, I want to emphasize the fact that under the Medicare Advantage Plus program, it is a passive PPO program, which provides coverage in or out of network, and your copayment will be the same whether you see an in-network or out-of-network provider. So it is a passive plan, which means your copayment will be the same whether it's in-network or an out-of-network participating provider. The program does not require referrals to see a specialist, so you do not need to get a referral from your primary care doctor in order to schedule an appointment with your specialist. You can see your specialist directly on your own. Now, the difference between traditional Medicare and a Medicare Advantage Plus program comes down to the medical necessity review process. Under traditional Medicare, Medicare looks at a claim retrospectively after a service was rendered. So when a provider submits a claim for a service, it goes into Medicare. Medicare reviews that claim for medical necessity. If medical necessity requirements were not met under traditional Medicare, Medicare could deny that claim and the member would be ultimately responsible for that bill. Under a Medicare Advantage program, the Medicare Advantage Plus plan, we do medical necessity review on the front end through a prior authorization process. Now, not every service requires prior authorization. So there's only certain services that would require prior authorization, and that would be handled directly between the provider and the plan. This is not something that the member would be responsible for coordinating. The doctors handle that directly with the plan. And some of those services that require prior authorization would be your planned inpatient hospital stays, surgeries, your complex diagnostic testing like CAT scans, PET scans, MRIs, your therapies like your radiation therapy, infusion therapy, your physical and occupational therapy, as well as your rehab admissions or admissions into a skilled nursing facility. So those are some of the most common procedures and services that would require the prior authorization on the front end. So the prior authorization is really to prevent any surprises, to ensure that all Medicare medical necessity guidelines were met prior to the service being rendered. So the base difference between traditional Medicare and a Medicare Advantage Plus plan is the fact that under traditional Medicare, medical necessity is reviewed on the back end retrospectively. And under the Medicare Advantage Plus plan, medical necessity is reviewed on the front end through the prior authorization process. Melissa, you can move to the next slide, please. Now, I wanted to review with everyone some of the member communication pieces that have been mailed out to retirees to date. The first one was the initial notice of change letter that came from the City of New York that announced the rollout of the New York City Medicare Advantage Plus plan for January 1st, 2022 for all Medicare eligible retirees and Medicare eligible dependents that are covered through one of the City of New York medical plan options. It also outlines the opportunity for members to opt out to keep the current plan that you are enrolled in today if you choose to opt out. Now, following that initial notice of change letter was the Medicare pre-enrollment guide. And this is the 44-page booklet that outlines the full benefit program and gives you a lot of information on how the program works. It also includes your opt-out form and opt-out instructions that are included in the booklet as well. Along with the booklet was a copy of the frequently asked questions document that was created by the City of New York and is also housed on the Office of Labor Relations website, as well as the side-by-side comparison. Now, the side-by-side comparison is available on the Office of Labor Relations website as well, and they will include plan comparisons for all of the programs that are offered through the City of New York today. So you'll be able to see how your plan compares to the New York City Medicare Advantage Plus plan, as well as review the rate sheet that includes all of the 2022 rates for all of the corresponding medical plan options that are offered through the City of New York today. So you can determine if your plan has a premium for 2022. Melissa, you can move to the next slide. Now, after you're enrolled in the plan, and I want to emphasize the fact that the City of New York will be automatically enrolling all Medicare eligible retirees and Medicare eligible dependents into the New York City Medicare Advantage Plus plan. So to be enrolled in the plan, you do not need to do anything. You'll be automatically enrolled into the new plan. All new plan members will receive their new identification card, and that will come towards the end of December so that all members will have their new ID card in hand before the 1st of January. Now, following the ID card, you will then receive a plan welcome guide. And the welcome guide goes into a little bit more detail in regards to how the program works and the benefits and services that you can access. And then we will continue to communicate with our members throughout the course of 2022 by sending out member newsletters on various topics. Now, after January 1st, once you're a member of the plan, members will be able to access online or get a paper copy of their full evidence of coverage. And this is your insurance certificate. So you'll be able to view this online or request a paper copy be mailed to your home. You'll also be able to request a paper directory for the geographic area that you live in. So if you want to have a directory for your New York area, and if you're a snowbird and you want the area in Florida that you reside in the winter months, you can request a paper physician directory for both areas. And both of those will be available to be mailed paper copy after January 1st. Now, regarding the evidence of coverage, we are in the process of finalizing that document with the City of New York right now. So we anticipate that we'll be able to post that online prior to January 1st. So members will be able to access that before they're effective in the plan over the next month or two. Melissa, you can move to the next slide. Now, I want to spend quite a bit of time talking about the enrollment and the opt-out process. So included in your pre-enrollment guide was the opt-out form along with the opt-out instructions. So if you choose to opt out to stay on the current plan that you are enrolled in today, you can choose to do so. And if you opt out, you need to submit your opt-out decision in a number of different ways. You can either opt out over the phone by calling the welcome call number, which is the 833-325-1190 phone number, or you can access the electronic opt-out link through the secure portal that's located on the empireblue.com/NYC-MA-plus website. And the secure opt-out link is located at the bottom of the web page, and you can log your opt-out decision securely through that electronic opt-out mechanism, or you can mail the paper opt-out form in, or if you choose to fax it or email it, you can do that as well. But the most secure methods to submit your opt-out to protect your private health information would be to do it telephonically, over the phone with a representative, or by logging into that secure site so that you can securely submit your opt-out information. Now, if you choose to opt out to stay on the current plan that you're enrolled in today, there could be a buy-up premium for that plan. So for senior care members, so if you're currently enrolled in GHI senior care today, and you want to opt out to keep senior care, the buy-up premium for the GHI senior care plan will be $191.57 for the basic plan, and $2.83 for that 365-day hospital rider. So it's a combined premium of $194.40 per member per month that will be deducted from your pension check each month if you decide to opt out to keep senior care. Now, if you have a retiree and a covered spouse that's Medicare eligible, that's roughly under $400 per month that will be deducted out of your pension check each month if you choose to opt out to keep the senior care plan. Now, as I mentioned earlier, the Office of Labor Relations website includes the rate sheets for all of the various plans that are offered through the City of New York today. So you can access that rate sheet to determine what your buy-up premium would be if there is a buy-up premium. So for example, many questions have come in from members that are currently under the HIP VIP plan today. The 2022 premium for HIP VIP will also be zero premium. So there's a zero premium for the HIP VIP plan. And the Medicare Advantage Plus plan is the zero premium plan guaranteed for 5 years. So you know that the premium for the Medicare Advantage Plus plan will be premium free. So it's zero premium for the next 5 years, and the benefits will not be changing either. So the benefits and the premium are guaranteed for the life of the contract, which is that 5-year period. Now, members have the opportunity to log their opt-out decision until October 31st. So I encourage all retired members to read through all of the information, educate yourself, make sure that you're making an informed decision. We still have close to 3 weeks to make our decision for our 22 plan options. So make sure that you're being mindful in regards to what you're deciding to do. And if there are members that are out there that have already submitted in their opt-out form and have decided that they want to change their mind, that they do want to go into the Medicare Advantage Plus plan, you have the opportunity to rescind your opt-out decision. So by simply calling the Welcome Center, you can let them know that you've changed your mind and you do not want to opt out, and we will make sure that we rescind that opt-out decision. So retirees have until October 31st to make their opt-out decision. Melissa, you can move to the next slide. Thank you. I wanted to review through some important dates and contact information for you. Once again, all Medicare eligible retirees and Medicare eligible dependents will be automatically enrolled into the New York City Medicare Advantage Plus plan effective January 1st, 2022. So you do not need to do anything. You'll automatically be enrolled in the new plan. If you decide that you want to opt out to keep the current plan that you're enrolled in today, you can do so by submitting in your opt-out decision by October 31st. and you can do the opt-out by either, as I said, telephonically or through that secure link or mailing in the form, however you choose to log your opt-out decision. Now, there's two websites that include a wealth of information. First, I'll go over the Office of Labor Relations website includes the copy of the frequently asked questions, plan comparisons for all of the programs that are offered through the City of New York today, the rate chart, as well as the health benefits applications on that site as well. So it houses all of the information. It also has a link that brings you to the dedicated website that we have set up for the Medicare Advantage Plus plan, and that's the empireblue.com/NYC-MA-plus website. And on that website, you'll be able to access an electronic version of the pre-enrollment guide, as well as access links to general information meetings, similar to this meeting that we're holding for the DEA today. So you have all the information on there, as well as the Find Care link so that you can look up providers. And then also at the bottom of the web page is the link to the secure portal to log your opt-out decision. The New York City Medicare Advantage Plus Welcome Call Center is open Monday through Friday, 8 a.m. to 9 p.m. Eastern Standard Time. And that number is 833-325-1190. And I encourage members to call the Welcome Call Center towards the end of the day. We seem to see spikes in call volume towards the middle of the day. So best piece of advice is I would call them between 5 p.m. and 9 p.m. That seems to be when the call volume goes down a little bit. And avoid calling the call center on Mondays and Fridays. Those seems to be the peak days. So word to the wise, Tuesday, Wednesday, Thursday, between 5 and 9 p.m. seem to be the best time to call the Welcome Call Center. I did want to confirm with everyone that retirees will continue to receive your Medicare Part B reimbursement from the City of New York. So that is not changing based on the Medicare Advantage Plus program. All members that are enrolled in a qualified City of New York plan will continue to receive that Medicare Part B premium. And that would also include the IRMA surcharge for those retirees that are paying the IRMA surcharge on their Medicare Part B premium. Your union welfare fund benefits that you're receiving through the DEA are not impacted whatsoever by this plan change. So you will continue to receive all of the benefits that you receive through the DEA today, which include your hearing, your vision, your prescription drug benefit. So that is not impacted whatsoever by this change. Another question that has come up from retirees is, what if you have a underage spouse who's not yet Medicare eligible, or you may have a dependent child that's under 26? Those non-Medicare eligible spouses and dependents will be covered under the GHI CBP plan. So the City of New York requires that the retiree and all covered dependents are with the same carrier. So the companion plan for the New York City Medicare Advantage Plus program is the GHI CBP plan. So the Medicare eligible retiree will go into the Medicare Advantage Plus plan, and the non-Medicare eligible spouse or dependents will stay on the GHI CBP plan. If you're currently on HIP VIP and you have a non-Medicare eligible spouse, that non-Medicare eligible spouse would be on the HIP HMO program. So the City of New York requires both the retiree and covered dependents be covered together with the same carrier. Now, the City of New York will also be opening the fall transfer period again next year, and that will be open on an annual basis. So you will have another opportunity next year to opt out of the Medicare Advantage Plus plan if you choose to go into the GHI Senior Care Plan or go back to the plan that you're enrolled in as of today. So the fall transfer period will be opened up on an annual basis. Regarding providers, I mentioned earlier that this is a national passive PPO program, which means retirees will have access to any Medicare participating provider in or out of the network. You are not bound to network only providers. So if you choose to see an out of network Medicare provider, we will pay that Medicare provider the full maximum Medicare allowed amount. So that out of network provider would simply bill the plan, the Medicare Advantage Plus plan, instead of billing Medicare, and we will pay that provider the same Medicare allowable amount that they're receiving through traditional Medicare today. So the providers will be paid the same amount. Now, if you come across any issues with providers saying that they're not sure if they're going to accept the plan, please reach out to the Welcome Call Center and provide us with the name and phone number of that provider so that we can do outreach to the provider's office to educate them on how the program works, to explain to them that they can simply bill the plan and we will pay them the same Medicare allowable rate. So let us advocate on your behalf and we'll do outreach directly to that provider's office. I think I touched upon most of the commonly asked questions that have come up through the course of the last 2.5 months. I did want to also emphasize, a question came up earlier about diabetic supplies and testing equipment. Those diabetic supplies and testing equipment are covered under the Medicare Advantage Plus plan. So we will cover all of that at a zero copayment. So that is included under the Medicare Advantage Plus plan. And then you will continue to get your diabetic drugs through your prescription plan that you have through the DEA, through Benecard. At this time, I think I will open it up to some questions and answers. I know that many of the retirees have pre-submitted some questions in to the DEA, and I'll be more than happy to field some of those questions from the DEA leadership now. Melissa, you could pull down stop sharing the screen, and I'll open it up for questions.
So Kim, this is Marlon. I just wanted to point out, can you go over eligibility, like who's eligible for this plan? Because we have several or a lot of the retirees, a lot of the questions that are coming in is that a lot of them are under 65, right? So those who are eligible for this plan, right? They're 65 and retired. And if not, they have Medicare disability. Is that correct?
Correct. So the members that would be automatically enrolled into this plan are all Medicare eligible retirees and Medicare eligible dependents. And that would be Medicare eligibility either due to age or due to disability. So if you're receiving Medicare due to disability, you would also be included in that auto enrollment process because you are Medicare eligible.
And once I enroll, what happens to our, if I am a retiree that's getting enrolled into the New York City Medicare Advantage Plus plan and I have underage dependents, what happens to them?
For the non-Medicare eligible dependents, so the underage dependents will be covered under the GHI CBP plan. So that is the companion plan that goes with the New York City Medicare Advantage Plus plan. So those non-Medicare eligible spouses or underage children would be covered under the GHI CBP plan.
Perfect. I see a recurring theme there. So that's why I wanted to call those two things out. Thank you. Just like Kim said, for those who are on the call, if you haven't received any of the mailings, there's two things. You may not be eligible for the plan because this is for those post-65 Medicare eligible or Medicare disability. Those are the retirees that would have received this notification. So if you haven't received it and you are eligible, you can call the 833-325-1190 number, and the customer service reps will mail one to you. In addition to that, if you want to look at the enrollment guide, that is available to you on the Office of Labor Relations website, which is that nyc.gov/HBP. Click on the retiree tab, And then you will just have to look for what is called out as the enrollment guide. You'll have the access to what is going to be mailed to you. So at least you can see it, a digital copy, while the hard copy is being mailed.
Okay, and I have those questions that we have reviewed prior to the meeting. So one of the first questions we received is, I'm moving to Central Florida in November. How can I find providers that will be in the service area for me? You'll have the ability to utilize the provider finder tool, which is the Find Care tool that's located on that empireblue.com website that I reviewed earlier. And if you click on Find Care, it'll bring you to the provider finder tool. You can type in the zip code in Central Florida that you're moving to, and then you can search for providers directly through that provider finder tool. And this applies for retirees that are in any of the 50 states. So you have the ability to search the provider network on a national basis. So the plan is national and it'll cover you in all 50 states. So you'll be able to look up providers that way. Or you also have the ability to contact the call center and have representatives help search for providers on your behalf as well. The next question is a similar question. It's talking about, I live in New Jersey. What doctors are in New Jersey that will accept the plan? The providers in New Jersey would be participating in Horizon Blue Cross Blue Shield. That's the national Blue Cross Blue Shield plan that's in New Jersey. So Horizon Blue Cross Blue Shield providers would be those in-network contracted providers. And you'll also have the ability to use the Find Care tool to be able to confirm your New Jersey providers are participating directly through the Find Care tool.
Kim, this also applies, since you're talking about the Find Care tool, it also applies for South Carolina and North Carolina. We know a lot of the retirees of this union have moved there, so you can use the Find.
The next question is, does this plan cover my spouse?
And if you're in Blue Shield Association, South Carolina. Go ahead.
Will the plan cover my spouse if I die? What will happen is your spouse will be able to continue coverage under the program under COBRA. And the COBRA premium for the plan for 2022 would be $7.50 per member per month. And for 2023 on, for the next 4 years, it would be a zero premium. So if your spouse would be able to continue under the plan if you pass away, and they'll be able to continue it under COBRA and pay the COBRA premium of $7.50 per month for 2022 and zero premium thereafter. The next question is, I currently have Medicare and GHI. Tell me the downside to this plan compared to Medicare and GHI. I don't understand where the big savings is coming from. This comes down to, it sounds too good to be true. The way the program is funded is the majority of the money actually comes from the federal government. So by the city of New York implementing the Medicare Advantage Plus program, they're able to realize tremendous premium savings because the majority of the plan is funded by the federal government. So that's where the majority of the money is coming from, is it's coming directly from the federal government to fund the majority of the plan. And that's where the big savings are coming from. Next question is, am I going to be automatically signed up for this? What are the new costs if I stay on my GHI senior care plan and I have a spouse who's younger? What happens to her? So yes, you'll be automatically enrolled in the new plan for January 1st, 2022, and your underage spouse will be enrolled under the GHI CBP plan. So her coverage will not change. So she's currently under GHI CBP today. You'll be enrolled in the New York City Medicare Advantage Plus plan. Your spouse will stay on the GHI CBP plan, and the program will remain premium free for both you and your covered spouse. Is the New York City Medicare Advantage Plus plan a PPO? Yes, it is a PPO, and it is a passive PPO, which means you have the ability to see in or out-of-network providers, and the cost share is going to be the same to you as the member. So if you see an in-network specialist or an out-of-network specialist, that will be a $15 copayment, whether they're in-network or out-of-network. Next question is, what specific tests require prior authorization? Some of those, it depends on the type of tests that you have done. Some of the common tests were the complex diagnostic testing that I called out, your CAT scans, PET scans, MRIs, those types of services are the common tests that require prior authorization. Now, we do have an expedited prior authorization process for urgent care situations, where if it's urgently needed that you need a test done, they will expedite the prior authorization within 24 to 48 hours. But typically, the standard prior authorization medical necessity review process takes about 6 days. If a service or test is denied, members and the providers will have the ability to appeal that decision. And typically the way it works is the provider is the one who would appeal that decision on behalf of the member. And there's 5 levels of appeals that the denial would go through. So ultimately, the medical review process is handled by medical doctors. So your doctors are speaking to other medical doctors, and then it's actually brought to a third party. So the final decision is actually made by an outside third party agency that's not affiliated with the plan. And those final decisions are made by medical doctors. Is the DEA going to still provide benefits like the Benecard drug plan, et cetera? Yes. All of your DEA supplemental benefits that you receive through the Union Welfare Fund are not impacted by the Medicare Advantage Plus change at all. So you will continue to get your drug, your optical, your hearing aid benefits, all of that through the DEA. Next question is, can I return to my GHI senior care next year if I want to without a problem? The answer is yes. So if you want to switch back to GHI senior care during the next fall transfer period, you can do so. So you have the ability to switch back next year. Will the Medicare Advantage Plus plan change coverage without notice? The benefit design is guaranteed for 5 years. So we will not be making plan design changes to the benefit program. The only time we would make plan design changes is if Medicare adds additional services that need to be covered. So the only thing that you would see would be additional benefits that would be added to the plan. And that would be required because if Medicare makes a design change, we have to follow the same rules and include coverage for that additional Medicare covered service under the program. Is the plan accepted by all who accept Medicare? This plan will pay all Medicare participating providers. So if it's an out-of-network provider that participates with Medicare, that provider will simply bill the New York City Medicare Advantage Plus plan, and the plan will pay that provider the full Medicare allowable amount, less whatever member copay would be applicable. So that provider would be receiving the same Medicare allowable amount under the Medicare Advantage Plus plan than they're receiving under traditional Medicare today. Do all hospitals, even in Florida, accept the plan? I can tell you that most of the hospitals nationally are actually in-network contracted hospitals. And of the hospitals that are not in-network contracted hospitals, all of them have accepted the plan and see our Medicare Advantage PPO members on an out-of-network basis. And those out-of-network hospitals would simply bill the plan, and we would pay those hospitals the same full Medicare allowable amount under the program. Most of the hospitals in Florida all participate in the Blue Cross Blue Shield of Florida network. Similarly, if you go to other states as well, Most of the hospitals are in Horizon Blue Cross Blue Shield and Blue Cross Blue Shield of North Carolina. So all of those hospitals would be affiliated with the Blue Cross Blue Shield National Association of Providers Networks. Next question, do both the member and spouse have to elect the same plan? This is a great question. The city of New York requires that both the retiree and eligible dependents be enrolled with the same carrier. So you as a spouse, retiree and spouse have to make the same decision. So you cannot have the retiree choose to go into the Medicare Advantage Plus plan and then the covered spouse opt out to stay on the GHI senior care plan. So you both have to make a decision together. You're either both going into the Medicare Advantage Plus plan or you're both opting out. You cannot make a split decision. You're tied together. Your dependent spouse follows you, the retiree, in the plan that you're going into. Next question is, can I continue to visit and receive medical exams, treatments at the VA hospital or as a military veteran? So for those retirees that are receiving the VA benefits, or some might be receiving TRICARE for life, the VA and TRICARE for life are not impacted by the Medicare Advantage Plus change. However, the plan will not be paying the VA for any services because two federal agencies don't pay each other. So you'll be able to continue to access the VA benefits and VA services, but the Medicare Advantage Plus plan will not pay the VA for any of those services because we now become your Medicare coverage. If you do receive prescription drug coverage through TRICARE or the VA, you can continue to utilize that prescription drug benefit. That's not impacted by this change either. So those were all of the questions that we kind of compiled through all of the various questions that were submitted in by all of the retired members of DEA. We tried to consolidate them. Many of the questions were a lot of duplicates. So we kind of pulled the ones that we saw were the most common questions. So those were the questions that we had gone through. Any additional questions or comments from the DEA leadership before I close it out and turn it back to Paul to do some closing remarks?
Nope, that's it.
All good. All right. Well, Paul, I really appreciate this opportunity. I appreciate everyone coming out to hear about the information. And by all means, please utilize that welcome call center and all the resources that are located on the websites. Thank you, everyone, and have a great day.
Kim, thank you very much for your time and consideration. It was well attended, and God bless you for doing it. We hope this answered many of your questions. This informational seminar will be posted on the DEA website, www.nycdetectives.org, tomorrow, October 12th in the afternoon. And as always, you could contact the DEA Health Benefits at 212-587-9120. Thank you for your participation, and thank you for allowing us to represent you, the greatest detectives in the world.